Okay, look. Hey, you see this, see the header on it? Brief room in the pool, and it cuts on 106, pool cuts. The pool, great. We can do a mic check here, it seems like. Mic check here, check, 1, 2, 3, 4, 5, 4, 3, 2. Scheduled for 1 o'clock briefing on Fox News Channel. Sounds hollow. How about down, Nate? Nate, we okay, Nate? Check, 1, 2, 3, 4. We're good.
Hey, can we get a no mask check for 1 second?
Thanks, Ryan. All right, bye-bye.
Just a 5 count with no mask.
Oh, okay. Mic check, 1, 2, 3, 4, 5, 4, 3, 2, 1. I didn't hear you. She wanted to check. 2, 3, 4, 5, 4, 3, 2, 1. Scheduled for 1 p.m. Eastern Standard Time. Mic check. Thank you, Nate. Thank you, Nate.
Not sure what they say about you. And they do. Davis is mine. Here we go.
What's up, Dad?
Paying attention.
Hi, Bonnie.
Thank you very much. Feel good.
So I'm pretty sure they have your stuff
Good.
out there, right?
Good to be back.
Yeah, it's right next to you.
Oh.
There you go.
I thought we were over there.
See, I'm the sound person of the United States.
Right.
Appreciate it.
So the next story, the reason that they kept delaying our call?
What, the Astrazeneca one?
Yeah.
Well, it's going worldwide, right?
Right, I know it wasn't just India, but like were they, was that like the reason that they kept putting it off?
Well, yeah, I don't know. To be honest, and it was, I just knew that we got it on the wire before the briefing. Was the goal.
It's a little weird.
So, I mean, all Z, yeah. It did. call you back in about an hour. Okay, and tell me your name one more time, please. Okay, thank you very much.
starting to like that. I know, you got
Also
excited.
like-
I'm sorry.
I know.
I know.
It's
I'm
exciting.
not as excited. Sorry to disappoint.
That's okay, you can stand up there and do it. Nobody, they're not here today. You were afraid to come in.
Totally.
I was like, oh. Remember Doug's entry? That was great.
Soon, guys, I promise. It's coming.
keep in order over there, man. That's all I'm saying. Keep in order. Over my house. Yeah, that's great.
Hi, everyone. Happy Monday. Okay. Our special guest today is our Director of the National Economic Council, Brian Deese, and he will be, as you may know, Brian was Senior Advisor to President Obama and previously served as Acting Director of the Office of Management and Budget. And in the Obama-Biden administration, Brian helped coordinate policy development for tax policy, housing, clean energy, manufacturing, and the automotive industry. Brian has agreed to come despite having the unenviable task of not being able to roll out many details of our joint session speech or the American Families Plan, but we still wanted to have him here to provide some context on some of the questions you all had raised. And he'll only be able to take a couple questions, but with that, I'll turn it over to Brian.
Thank you, Jen, and it's good to see you all again. So I wanted to just provide a little bit of context around, in particular, capital gains taxes, and we'll provide just a little bit of context, and then happy to take a couple of questions. So, as you know, and as Jen has spoken about, the President is excited to this week lay out his plan to invest in American families. It will be a plan that will provide critical support for children and families, and by doing so, critical support for our economy by boosting labor force participation and future economic competitiveness, making among the most cost-effective measures to boost our long-term economic strength that we know of. And the President will also outline ways to offset the long-term costs of those investments by making reforms to our tax code that reward work and not just wealth. And one element of this reform will be to change how we tax capital gains. As you all know, that's income from selling stocks and other assets for taxpayers that make more than $1 million per year in income. So I want to start by reinforcing who this change will actually affect. This change will affect taxpayers making more than $1 million a year. In 2018, 0.3% of tax filers made more than $1 million a year. So I want to start by underscoring this in simple terms. This change will only apply to 0.3% of taxpayers, which is not the top 1%. It's not even the top 1/2 of 1%. We're talking about 0.3%. That's about 500,000 households in the country that we're talking about. So for the other 997 out of 1,000 households in the country, or the other 150 million households in the country, this is not a change that will be relevant. It won't change the tax treatment of capital gains at all. And this makes sense because for the typical Americans, most of their income comes from wages. So for people making less than $1 million a year, about 70% of their income comes from wages. But for those making more than $1 million, for the top 0.3%, it's the opposite. About 30% of their wages come from wages. And that's probably actually an understatement, since the wealthiest can often strategically avoid reporting this type of income entirely. And so as a result, this is the provision that since 2000, if you look at the 1,400 tax filers, those are people making over $60 million a year. That's the, for those of you keeping track, that's the top 1,000th of 1%. They have only paid about 20% of their reported income in taxes. So their tax rate, which probably is overstated, again, because this is the category that often doesn't report or underreports income. Their tax rate is lower than many middle-class families' tax rate. This is the dynamic that led Warren Buffett to famously explain that he paid a lower tax rate than his secretary. And it is the dynamic that has led the president and others to argue that we need to do something about equalizing the taxation of work and wealth in this country. And that's why the reforms that the president will lay out are focused on this top sliver of people and treating capital gains the same as wages for that top 0.3%. And we believe that it's not only fair, but it would also help to reduce the kinds of tax avoidance that significantly undermines trust and fairness in the tax code itself. And importantly, the revenue from this provision would help invest directly in our kids and our families and our future economic competitiveness and put us in a position where we can drive greater economic growth. So we'll have more to say on this and how it fits into the overall plan, but I just wanted to underscore at the top that number one, we're talking about a tax change that would affect, again, the 0.3%, the top sliver of households. And number two, the principle here is to equalize the treatment of ordinary income and capital gains. And that is a principle that's neither new nor particularly novel. In fact, the last president to enact a reform to equalize the treatment of ordinary income and capital gains was President Reagan, who did so while raising capital gains taxes as part of the 1986 tax reform. And of course, we will be raising to higher rates than in that reform. But a lot has changed in the economy since then. A lot has changed in the academic and empirical research in this space. But the principle is the same, which is that for the very highest income Americans, we should tax at the same rate ordinary income and capital gains. So with that, when I pause and could take a couple of questions.
Thanks so much for doing this, Brian. Just to make sure I understand this, critics say that you tax capital gains at lower rates to incentivize investments that help the economy grow. Is the administration's perspective that among these high earners, they have not been making the investments to help the economy and that the government programs can do it better?
So across a wide body of academic and empirical evidence, there is no evidence of a significant impact of capital gains rates on the level of long-term investment in the economy. If you look back over the last 30 or 40 years, we've had capital gains rates at various rates. We've seen different levels of investment and overall economic growth. You can't identify a meaningful correlation between the two. There's lots of reasons for that, including that if you look at where a lot of venture capital and early stage investment comes from, it actually comes from pension funds, sovereign wealth funds, entities that actually are not tax sensitive. Also because at the end of the day, a lot of things go into making an investment decision. But certainly our view and reading of the evidence is that there is not there's not a correlation that would significantly affect investment for these highest income individuals, number one. And number two, we can use those resources to invest in areas that we know where there is convincing academic evidence, empirical evidence, that investments, for example, in early childhood and in our children return enormous dividends in terms of their own academic success, reduced costs in the healthcare system, productivity, and growth in the future.
Catherine? Brian, one question on the Families Plan itself. Why isn't the White House including a plan to reduce the price of prescription drugs in the plan?
The good news about a question like that is I get to tell you that since we haven't rolled out the Families Plan yet, and I'm not going to do it at the podium right now, I am not going to confirm whether or not that is in. I can say that the president has long focused on the issue of rising costs of prescription drugs for American consumers and American families. It's something that he continues to focus on and prioritize, but I'm going to let him speak to those issues in the speech.
Andrew?
Yeah, Brian, so on the question of how you enact this, so is this capital gains tax increase dead on arrival when it comes to the Hill? The Republicans are screaming that it is not a good proposal. There's even some concerns in Democratic circles. Like, how do you convince people that this makes sense?
Well, I would say a couple of things to that. The first is on the facts and on the evidence, to go to the conversation we were just having, that we think that the best read of the evidence is actually that making this sort of change for that top 0.3% of taxpayers, equalizing ordinary income and capital gains would restore fairness and do so in a way that wouldn't significantly affect investment, and that would allow us to make really high return investments for which there's been broad bipartisan support. So we think that that's a pretty sensible way of going at it, number one. Number two is the president has said in the context of the jobs plan and the corporate tax reform plan, and will say in the context of this plan as well, he is laying out his jobs plan and his family's plan. This is his vision for how we need to put in place a public investment agenda for the country. He is also identifying ways to responsibly pay for it, and he is welcoming and encouraging others to come forward with their ideas as well.
Are you going to need reconciliation to do this?
I think what you're going to hear from the president is a call to consider these investments and the potential that they would provide for the country, and engage in a serious conversation about both whether these investments are needed, and if we can agree that they're needed, how we're going to offset their cost. He's starting that conversation where he believes it's a responsible place to start, by putting a plan on the table, and we'll take the conversation from there.
Jeff?
I want to pick up on something you mentioned about investing in kids and ask you about the child tax credit, not specific to the American Families Plan, but just in general. Some of the president's Democratic allies on the Hill, as you well know, have pushed to make that permanent. They say they've faced some resistance, some pushback from the administration. What's the argument against making it permanent? Is it economic or is it political, in that Democrats potentially might want to run on this in 2024, and if you make it permanent, it robs Democrats of that opportunity?
Well, let me start by making the argument for the expanded and fully refundable child tax credit, because it was President Biden who put a temporary one-year expansion of the child tax credit in his American Rescue Plan, which he announced on January 14th, 7 days before he was even inaugurated. And it was President Biden who worked with Congress and fought to get that enacted into law. And now, as a result, the American families of 66 million children will receive a fully refundable expanded child tax credit this year. And that will be delivered monthly going forward. And the best estimates are that in combination with the other elements of the rescue plan, will reduce child poverty by 50%, by about 50% this year. So President Biden is both incredibly proud of that accomplishment and the speed with which we were able to implement it, and believes that we should extend that policy to provide some certainty and stability to those families who will be relying on that payment, but would see it go away if Congress doesn't act. So that's the context for it, and I'll let the president speak to the specific plan in the joint session speech.
I've gone already way over the time allotted. He will come back, as will other people, but Brian's got to go. Sorry, Brian. Thank you for coming, and he'll come back soon.
It's always so much easier for me to play good cop. Now I realize why. You know, I take all your questions, but Jen.
Okay, come on back. Right, exactly. Well, there'll be much more to say when we roll out the speech. Okay, a couple of additional items for all of you at the top. Today, the U.S. Department of Agriculture and Secretary Vilsack announced the historic expansion of the summer pandemic EBT program. This is the single largest summer child nutrition effort in our nation's history, and will reach more than 30 million kids this summer, thanks to the American Rescue Plan. Summer feeding programs are considered a lifeline for some families, but until now they've reached less than 20% of families served during the school year. Children are eligible for this program if they are eligible to receive free or reduced price meals during the school year, or if they are under age 6 and live in a SNAP household. That is about 34 million American children. Parents or guardians do not need to take any action to receive the cards in the mail from their state agencies. Each child will receive a $375 credit loaded onto an EBT card, and can then be used by parents or guardians to purchase Food. Also today, President Biden will sign an executive order establishing the White House Task Force on Worker Organizing and Empowerment. This task force is a historic effort to mobilize the federal government's programs, policies, and practices to empower workers to organize and collectively bargain with their employers, and will have a specific focus on increasing worker power in marginalized and underserved communities. Vice President Harris will be chair of the task force, and Secretary of Labor Marty Walsh will be the vice chair. The task force will include more than 20 cabinet members and department heads. Also, Vice President Harris will have a bilateral meeting with the President of Guatemala this afternoon. They'll meet virtually to discuss working together to address immediate relief needs of the Guatemalan people, as well as deepening cooperation on migration. The Vice President will also participate in a roundtable with representatives from the Guatemalan community-based organizations tomorrow. Vice President Harris's direct engagement is a testament to the importance we are placing on improving conditions in Guatemala. When the Vice President spoke last with the President of Guatemala on March 30th, they agreed to collaborate on promoting economic development, leveraging technology, strengthening climate resilience, and creating the conditions to expand opportunity for people in their home countries in order to address the root causes of migration. Finally, as you may have also seen today, we announced that the administration is looking at options to share American-made Astrazeneca vaccine doses during the next few months. Given the strong portfolio of vaccines that the United States has already authorized and available in large quantity, and that is available in large quantities, including two-dose vaccines and one-dose vaccine, and given AstraZeneca is not authorized for use in the United States, we do not need to use AstraZeneca in our fight against COVID over the next few months. Before any AstraZeneca doses are shipped from the United States, the FDA will confirm any such doses meet its expectations for product quality. This is being done in the context of the FDA's ongoing review of all doses made at the plant where these AstraZeneca doses were produced. And I anticipate in the near future, our team will share more details about our planning and who will be receiving doses from here, but we're in the planning process at this point in time. Josh, go ahead.
Thanks, Jen. Let's go to India and what they're dealing with the coronavirus. The president just spoke with the Prime Minister of India. Can you give us some more details about that? And in terms of how many supplies, what all are we really going to rush out there? What's the volume and the scale to deal with the problem?
Sure. Well, as Josh noted, and you may have all seen the readout that we just put out, but just in case you didn't, the president spoke today with Prime Minister Modi of India, committing that the United States and India will continue to work closely together in the fight against COVID. The president pledged America's steadfast ongoing support for the people of India who have been impacted by the recent surge in the COVID-19 cases. In response, we have provided, and let me give you more of a specific update, and I will also note for you that there'll be an additional call later this afternoon that will provide additional details. So this is just what is available at this point in time of what is being requested and what we are providing. So there are a number of areas that are of great interest and are of great need to India at this point in time. Oxygen is one of them. At India's request, we are exploring options to provide oxygen and related supplies. The Department of Defense and USAID are pursuing options to provide oxygen generation systems. We may be in a position to reroute shipments planned for other countries with lower immediate needs, given the urgency of the conditions in India, and we'll have more details, hopefully, on the possibility soon. DoD is also exploring providing field oxygen generation systems, which we have used in our field medical hospitals. Each unit can provide oxygen for up to 50 to 100 beds. And we're also exploring options to provide oxygen concentrators and ventilators, and are in technical discussions with India to ensure the equipment we supply can connect to Indian devices. The United States has already provided 200 ventilators to India last year and trained medical professionals on their use. So this is, of course, in addition to that and other assistance we've provided. Another one of the major needs is PPE. And we've identified U.S. commercial suppliers as well, and therapeutics and tests, but we've identified U.S. commercial suppliers of remdesivir that are immediately available to help relieve the suffering of COVID-19 patients in India. We've identified rapid diagnostic testing supplies, personal protective equipment, and additional ventilators available to be transferred to India immediately. And I noted, of course, and we also, of course, are in close touch with India officials at all levels about the raw material needs that they have. And as requested by India, we will provide raw materials for the production of Astrazeneca Covishield vaccine at Serum Institute of India. I know some of these have been announced, but that's just a little bit of additional details. So we're in ongoing discussions about what their needs are and how we can meet them. But go ahead.
And then, secondly, the president issued a 100-day mask mandate for federal buildings. Does the administration plan to update its mask guidance now that we're at 100 days roughly of the Biden presidency? And what about for the broader country? What science, what research are you using to guide you?
Well, I know there's been some reports out about CDC plans, and we will certainly leave it to the CDC to announce their guidance, which I think was the second part of your question, about what will be required outside and when masks will be required for individuals who have been vaccinated. So we won't get ahead of any final details or announcements they will make. The president, of course, issued that at 100 days. We're not quite at 100 days, so I don't have anything more to preview for you in terms of what might be next. Go ahead.
Looking ahead to Wednesday, to the president's speech before a joint session of Congress, can you give us a sense of how the speech is coming together, the president's involvement in it, how he wants to use that speech, and his appearance there to sell the remainder of his legislative agenda?
Sure. Well, first, the president has been working over the last couple of days, as he will be over the next two, on his speech. He's deeply involved in the development of his speech. He's thinking a great deal about what message he can send directly to the American people about what progress we've been made, but of course what challenges remain ahead. He recognizes, as somebody who served in the Senate for 36 years, that this is an opportunity, one of the highest profile opportunities even the president has each year, to speak directly to the American people, and that's exactly what he intends to do. He will lay out the specific details of the American Families Plan in that speech, but he will also talk about a range of priorities that he has for the upcoming months of his presidency, including putting in place, working with Congress to put in place police reform, including doing more to expand access to affordable health care. So there will be a range of priorities he will also mention in his speech, but he's working closely with his speechwriters on it, but also with policy advisors and the policy teams on finalizing the components that will be in the speech.
And on COVID in this country, what's the level of concern within the administration that apparently 5 million people, or about 8% of those who got the first dose of Pfizer and Moderna, didn't return for dose 2?
Well, what I'll say is that there's no precedent, right? There's no playbook. And the other way of looking at that is that we're pleased that the vast majority, or 92% of people, came back for their second doses. And that is actually a pretty significant number in our view. We know people lead busy lives, but the second dose is critical to getting the maximum level of protection to help defend against variants and get people the longest lasting protection. And that is certainly a message that is being projected by our health and medical team and doctors who are speaking on behalf of the administration, as it was over the last couple of days. I'll also say that a big part of our effort as we shift into this newer stage, which is less about supply and more about reaching people where they are, is making it easier to get vaccinated. And that certainly applies to people who have not yet received their first dose, but also applies to people getting their second dose. So partnering with doctors' offices, setting up walk-up sites, helping workers get paid time off. That's all a part of our effort to ensure people are getting both doses of the vaccine if they're doing the 2-dose vaccine. Go ahead, Peter.
Thank you,
And
Jen.
congratulations. And not to embarrass you, you got married.
I did, yes.
Wow.
Thank you very
Congratulations.
much.
Welcome back.
Thank
All right.
you. Thank you, Jen. First, Vice President Harris says that she's not gone to the border yet because we have to deal with COVID issues. What is she referring to?
Well, I would certainly have to ask her team about that specifically, but I would tell you also that her focus is not on the border, it's on addressing the root causes in the Northern Triangle. And that's why the majority of her time has been spent on working with, on a diplomatic level. She is going to have a bilateral meeting with the President of Guatemala this afternoon. She's going to speak with the President of Mexico next week, and she's working with them to ensure there are systems put in place to reduce the amount of migration coming from these countries, but also to address the root causes, and that's really what the president's asked her to do.
Then I guess, if not with regard to her specific statement, is there a White House concern when you guys are planning presidential or vice presidential travel, but more about COVID at the border than other places that she has traveled recently?
We certainly know that the number of people who are in facilities, the reason we have been so focused on expediting moving kids out of these Border Patrol facilities is because we want to reduce the public health impact in these facilities and get them into spaces where we can do social distancing and when we can ensure these kids have access to health and medical experts and educational resources. So that's certainly, and we've made some progress on that front, even over the last few weeks since you got married, I will say, on that exact issue. So look, but if a president or a vice president goes down and visits a facility like this, you have to potentially clear some parts out. There's a lot of security that comes. Our focus here is on solutions, on making progress, on moving these kids out of these facilities, on getting them connected with sponsor homes, with family members if possible, and that's really where the president's focus is at this point in time.
And then about those facilities, there was a report in the last couple of days in the New York Post that every migrant child being brought to a shelter is being given a copy of her children's book, Superheroes Are Everywhere. Do you know why that is and if she is making any money off of that?
Of the president, of the vice president?
President's book, yeah.
I'd have to check with our Health and Human Services team if you're talking about if they go to shelters or if they go to.
Yeah, in the welcome kit, apparently, there's a copy of her 2019 children's book, Superheroes Are Everywhere.
I'd have to certainly check on that. Here, it's a good book.
And then I've got one more. Why was President Biden the only world leader at the climate summit Zoom who was wearing a mask?
Because he is sending a message to the world that he is putting in place precautions and continuing to do that as leader of the United States. And I don't know what setups they all had in their countries. That may warrant some more reporting or not, but obviously he had a pool there for portions. There were additional staff there, additional personnel, and that's the sort of model that we try to keep ourselves to here.
But I know the CDC's website and their guidance is that you can gather indoors with fully vaccinated people without wearing a mask or staying 6 feet apart.
That's actually for in your private home, so it's not workplace guidance, and we still wear masks around here, just like you are all wearing masks, and we wear masks in our offices and continue to abide by that until that guidance changes.
Thank you.
Hi, Mary. Go ahead.
Hi, thank you. Our latest poll over the weekend showed that the president has a 53% approval rating, which is, of course, lower than any recent past president, except for President Trump. Just 52% approve of his handling of the economy. Why do you think that is?
Well, first I would say there were a bunch of polls over the weekend. I know you're asking about yours specifically, but there are also some very positive signs about the American public's view of the president's job he's doing, including his response to COVID and the pandemic, something that's on the minds of the majority of the American public. According to the NBC poll, it was 69%, CBS 65%, ABC 64% approval. Also, I will also note, per our earlier discussion, that according to the ABC poll, 58% of the public approved of raising corporate tax rates. But the bottom line is the president, these polls show what we have long known, that the president came into office at one of the most divisive moments in modern American history. And the president's focus is on fulfilling his promise to bring the country together. So in large part on delivering on the things the American people were elected him to do, which we have seen broad approval for, getting the pandemic under control, turning our economy around, especially for working families and the middle class. So we know that bringing the country together, that getting through what is a height of divisiveness in our country is going to take some time, and that certainly we see is reflected in the polls.
So when you do look at these numbers, what lessons do you take away, if any, in terms of how you may approach the next 100 days?
Well, the president would be the first to tell you we have a lot of work left to do to get the virus under control, despite the fact that 2/3 of the public in all of these polls support his approach and support the progress that's been made to get our economy up and running. There's still 10 million people out of work, and people aren't feeling satisfied by that. And we still need to keep our heads down and keep pushing forward to get the American Jobs Plan passed and ultimately the American Families Plan passed. But also he knows that he needs to continue to work at bringing the country together. And he will always be open to bipartisanship. He will always have an open door in the Oval Office to members of Congress of different viewpoints to get work done for the American people. And he certainly believes that's what people elected him to do.
And on the speech on Wednesday, obviously your first joint address is a big moment for any new president, but this is not going to be a joint address like we've seen before because of the pandemic, a lot of the pomp and circumstance. won't be there, the audience will be scaled down, no guests, etc. How is the president modifying his approach to the speech to sort of accommodate these unusual circumstances?
You're right, and it will look very different for people who are watching at home, who are used to seeing, they may not even know they're used to seeing this, right? But they're used to seeing a full Senate chamber, full House and Senate, full members of Congress they're used to seeing guests for all of these members of Congress. They're used to seeing, which is always an important part of the speech, a First Lady's box that's full of incredible people who are inspiring, have inspiring stories, and the president references in his speech, and that's tradition as well. And none of that will be a part of the speech in the same way that people have seen in the past. So there's certainly an adjustment to how he'll speak to the audience, speaking directly to the American people at home. That's always a part of it, but even more so to not having all of these incredible stories, inspiring stories that are typically a part of any president's joint session or a State of the Union address. So it will look different, but from his vantage point, it still is an opportunity to speak directly to the American people about the progress that's been made, the work that's still ahead, his new proposals for an American Families Plan, and some of the priorities that remain central to his presidency, and that hasn't changed.
And will he be wearing a mask? Because I think technically now the rules are such that anyone speaking on the floor must be masked, or will there be an exception for the speech?
I'll have to ask him that and ask our doctors that. It's a great question, and let me get back to you so people can know what to expect. Go ahead.
Thanks. Quickly, because I didn't get to ask Brian Deese this, is the $1 million threshold for the capital gains tax increase applying to households or individuals? Do you know?
These are all excellent questions, and I know I put him in a very difficult position, as I am too, because the speech is not for 2 days, and we will have lots of briefings that will go through all of the specific details.
So you can't clarify right now if it's, because you did confirm that there will be a capital gains tax raised, but
yes, and over $1 million is what's been reported. That's accurate, but I'm not going to get into more specifics. I will see if there's more we can provide to you after the briefing, but we've been quite careful about not getting ahead of the president.
Noted. Another topic, the European Commission president said over the weekend that vaccinated American tourists can safely enter with